You're listening to Who's Tom and Dick, a weekly podcast with your hosts, Martin Weavers, fighting stage 4 lung cancer, and Patrick Mortimer, living with heart disease. Why not grab yourself a cup of coffee, sit back, and enjoy the chatter as we discuss and share information, talking about tough subjects, and offering help, support, and motivation with a positive mental attitude.
Good morning, everybody, and or good evening in certain parts of the world where you listen to this. And welcome to Who's Tom and Dick. I'm Martin Weavers.
And I'm Patrick Mortimer.
Hello, Patrick.
I've never had such a formal introduction before on this programme.
New series and new intro.
Yeah. Last week's was quite interesting, wasn't it? I found that really interesting about the injection, weight loss injection. And we've had a few comments back. Perhaps we'll go into those another day.
Yes.
But we're still waiting to book this lady who's actually been on the drug and been very successful on it.
Well, we're just waiting for the email from her now to come back to arrange a date, aren't we?
Mm-hmm.
So,
and of course, you've got to go in for some scans on your, dare I say it, brain.
I have, yes.
To see if there's any cancer.
And we know what he's going to say about me having a scan on my brain without even asking him.
This is a recommendation by the Royal Marsden. I don't understand why, but why have they recommended or suggested that you should have a brain scan?
When I first took the trial drug, they said you got to have a biopsy, an MRI, and then, and obviously take the tablet. But they did say that the brain, the MRI and the biopsy were optional. Mm-hmm. Well, now I've found out that because last week I was sick I was sick once, and then the next day I felt a little bit, lightheaded and all that. So they said because of this, they say that the cancer can spread from my lung to my brain.
Right. So is this normal with lung cancer then?
Yeah, normal lung cancer can spread from the lung to the brain.
I've not heard that before.
Yeah, nor had I, and that's why I questioned them, because I said to them I'm against it, and they said, well, this is why. And when I listened to it, I told Linny, and I thought, I'm still against it, but I don't want to be one of these patients who is against this, against that, and then they're going to say, all right, Mr. Weavers, thanks very much, we'll take you off the trial.
Yeah.
Although it's optional, and professional people, I don't think would say that.
You don't feel you're being bullied into it?
Well...
What did Dr. P say about it?
Dr. P said that if you don't want to have it, you shouldn't have to have it. If I think you needed a head scan, I would have sent you for one by now. He said, but if you put 100 oncologists in a room, 50 of them will say you need to have a brain scan, and 50 of them say don't bother.
And one would say, I can change a light bulb.
Yeah, that's right. Oh, you wouldn't see an oncologist changing a light bulb. But that's what he told me. So
you've made the decision to have the scan, yeah?
Well, I did make the decision, and then after talking to him, I made the decision I wouldn't have it. And then they rung me again, and I wouldn't use the word bullied, like you just said, but persuaded that I ought to, because it was mentioned that if I did have cancer of the brain, then I could have a blackout at the wheel of my car. I could get killed, someone else could get killed, so it's a bit guilt there, isn't it?
Yeah.
I'm being guilted into having it, but, I don't like, I'd never say who said it, but that's the way I felt. And then my other conclusion to it was, MRI, if you've never had one, is where you go into the little tube and you have a helmet on.
A chamber.
Yeah, that's right. And have a helmet on. And all it sounds like is a pneumatic drill going into the side of your head. Now, those of you who have had it will know what I'm saying. You can have music, which I did because I've had two. They looked up my records and found I'd already had two. But the trouble was, Pat, I came out of there. The first one, I was in tears. I felt frightened. The second one, I said to them, I heard music, and they said to me, well, you can pick your own music. Mm-hmm. So the second one, I picked my own music, but going back to the first one, they told me I'd only be in there for 15 minutes.
Yeah.
Right. Now, when I used to sing, 15 minutes was about 5 songs. Mm-hmm. I actually counted the songs as I was going through, and I got to 8.
Right.
And I thought, I'm in here longer than 15 minutes. They give you a button to put on your chest. So if you panic, you can press the button.
Yeah.
And that can stop the whole thing. And I was so close on that 8th record to pushing the button. And then they said to me, all finished, Mr. Weavers. And I'd come sliding out. And that's when I broke down. And then a couple of weeks later in hospital, they said they need to do some other part of my head. So I thought, why couldn't you got it all in one go? Mind you, I got a big head, haven't I?
Yeah. So what songs did you choose?
I chose the Bay City Rollers.
I think I'd rather listen to The Machine.
I picked them, and I don't know how many songs of those I listened to, but anyway, I came out and I had the second one, and no trace. But the reason why I'm reluctant to have this MRI is because they say that if they find a trace of cancer, they have to notify the DVLA, and you lose your driver's licence completely. Right. So, do I want to lose my driver's licence? No, because I need to see my grandchildren. Mm-hmm. I need to see my children.
I would have thought your first worry would have been, I've got brain cancer.
Yeah, I suppose so. Linny said that.
You know, rather than losing your licence. But then that's how you're dealing with this, isn't it? You're trying to live a normal life with cancer. Or let cancer run your life.
Correct. Yeah, that's exactly how I feel. And I didn't want to, lose my mobility, really.
So let's talk benefits then. So they've asked you to have this scan, which you don't really want. The disadvantage is, shall I say, is that you could lose your licence and you could have brain cancer. And the benefits are? What are the benefits? Can they treat it if they find you've got brain cancer? Is there a treatment for it?
Obviously, if I have the scan and there's nothing there, then I know in my mind I'm clear of it. Mm-hmm. So that's the benefit.
If there's nothing there, you ain't got a mind.
But that would be 100% benefit to me.
Yeah.
Knowing I haven't. I don't feel in myself as if as anything's altered in my head.
No.
But then I do say that about my lungs sometimes. I don't even feel if there's anything wrong with it.
My point was, can they treat the cancer that's in your head if you've...
Oh, they'd start straight away, wouldn't they?
They can. Okay, well, there is a benefit then, really.
But yeah, which I spoke to Dr. P about, and I said, if they did find any cancer in my brain, if I have treatment for it and it goes, can I then get my licence back? And he said, you'd have to be a year free of cancer for the DVLA to even consider it.
Issue it, yeah.
So...
well, we wish you all the best with that.
Yeah,
I'm sure you'll report back.
Yeah, well, what I can do, because it's a different subject altogether, I might do a little diary as I go up and do a little bit of what's happening up there. Yeah. Obviously, I won't be able to do it while I'm in there, because when I go up, I've got to have... First thing I've got to do is the CT scan.
Yeah.
Then I've got to go for a blood test, and then I've got to go for consultation with the team. Mm-hmm. So it's a busy old day on Friday, but... yeah, I'll keep you posted. So
we'll follow that up in a later podcast.
Yeah, and, but you've been looking into something like I did with my injections. You've been looking into something that's close to your heart.
Very close to the heart, really. Yeah.
Yeah, which, not a pun, but stents.
Yeah, I am a member of a lot of forums on heart conditions after starting this podcast, really, to see how others are dealing with the same thing that I've got, because it's very interesting to realise that you're not the only one that's got something.
Well, can I just say something on that? I joined a lot of people on cancer ones.
Yeah.
But I found them very, very, very negative.
They are negative.
Yeah.
A lot of them.
Yeah. So
there are a few supportive people commenting on people's recent diagnosis. But a lot of them are negative.
Perhaps I ought to start up a Facebook supportive cancer.
Be a good idea.
Yeah, that's what I just found. So... you've obviously found the same.
Yes, well, stents. I mean, stents. I've had a stent. I've had several stents over 2 heart attacks. So that's a subject that I hold close to my heart, if you'll pardon the expression.
Yes.
The reason why stent surgery is necessary is for a number of reasons, normally down to CAD, coronary heart disease. The most common reason is fatty deposits known as plaque are built up in the coronary arteries, narrowing them and reducing the blood flow to the heart muscle. Symptoms often include chest pain, angina, shortness of breath. Mm-hmm. A lot of people may not realise that they're suffering from this if they've got asthma or other things. Even being overweight can make you short of breath.
Yeah.
But there could be an underlying problem. An acute heart attack, a stent may be inserted during an emergency procedure to quickly open a blocked artery, restore blood flow, and minimise heart damage. So that's a reasonably common procedure these days when people find for the first time that they've got narrowing arteries.
Yeah, because I've known people who've been rushed in, and then they come out, oh, I've got so-and-so stents now, so many stents.
Yeah. Another reason can be worsening angina. You know, you could have been diagnosed with angina, not had an angiogram, which is a exploration into your heart and the arteries around your heart to see if you've got any blockages or narrowings. But worsening angina, for patients with chronic stable angina that is no longer controlled by medications, can call for stents, and stents can improve blood flow and reduce or eliminate chest discomfort during exertion.
Can I ask you how they put a stent in?
You can. A stent can be inserted in two ways. Well, one way, but in two locations. My first stent was inserted through my wrist.
Oh, right.
Under local anaesthetic, what they do is they inject your wrist so that your wrist completely goes numb. They make a small incision into your artery. They insert a dye, and this dye flows all the way into your heart through the artery that they've opened up. And then on a monitor, you can see your heart pumping and all the arteries surrounding your heart. And you can see if there's any blockages in any of the arteries.
You can see this on your...
Yeah, well, yeah, if you want to. I laid awake watching it.
Yeah.
Better than EastEnders. Once they've discovered that you've got blockages, they can then insert a stent, which is, how can I explain it? It's just like a piece of gauze, but a tube.
That was going to be my next question, wasn't it? Yeah, what they look like.
So they insert a stent. So what they do is they insert a tube into this artery.
When you say a tube, is it like 1 mil, 2 mil?
I don't know. It's very, very thin. But it's a fine wire. That's probably the best way to describe it. It's a fine wire. Now they drive or push this wire into your artery, and it's got a little bubble on the end. And then before the bubble is the stent. So what they do is they push this wire into your arm and feed it up through your shoulder and into your heart, which is absolutely amazing when you think about it. And then they direct it into the blood vessel that's blocked or narrowing, and push it past the narrow spot so that the stent is located within the narrow spot. And then they pull the wire back, which has got like a little balloon on it. And when they pull this wire back, it opens up the stent, and the stent stays open. Remember, this is a wire gauze type thing. And they pull this back, and the stent is then opened up. And what that does is open up the narrowing in the artery, and they pull the wire back out again.
Wow.
And they do it again if you've got more than one blockage. And then obviously they seal the wound up that they've made in your wrist. And
how big is the wound on your wrist?
Mine was about half an inch.
All right.
They can also do exactly the same process through the groin, which is what happened to me the second time.
Right.
The reason they do the groin is because it's a straight route to the heart. Whereas with the wrist, they've got to go round the shoulder and into the heart. So they always prefer to do the groin because there's less complications and it's just basically an easier route.
Well, this is what one of our guests was talking about, wasn't he? About where his groin... It's like a saddle with your veins going down your legs and all that. So what they've done, they've interrupted it halfway, haven't they?
That's right, yep. And gone into your groin and done exactly the same procedure. The recovery time is a little bit less with the surgery to the wrist because they can wrap it up and plaster it up and seal it. So they can stop the blood flow and it can heal quicker. With the groin, you can imagine, you're sitting down, you're walking, got to go to the toilet. So there's a lot more movement there. So the wound takes a bit longer to heal. The better you can sit still, or the longer you can sit still, the quicker that will recover, but it's not always easy.
No.
So that's really the stent. It's not an invasive procedure.
No.
When I had my first one and I knew I got to have a second one after my second heart attack, I wasn't worried about it.
No. Did you think it was going in your wrist again? Or?
Yeah.
Yeah. I just thought they went straight in at the heart.
Oh, did you?
Yeah.
Yeah.
And I thought you'd got a whole, a mark, in your skin where your heart was.
No, if there's more serious issues, then they'll cut your chest open.
Yeah.
And do open heart surgery.
Oh, wow.
But this is really stenting we're discussing today. So, so that's really down to significant artery narrowing that requires a stent because it's restricting the blood flow around your heart.
Yeah.
So, I mean, going through a procedure of a stent, what they normally do, if you've not had a heart attack but you're finding out for the first time that you need stents, what they'll do is blood tests, ECGs, possibly do some imaging of the area, and an angioplasty is normally the only way to find out really accurately how blocked your arteries are.
And what is that?
That's where they do the same procedure, but they're injecting the liquid dye into your heart so they can monitor on screen.
So there's no treadmills involved in anything like this?
Well, that's leading up to it. If you go into hospital and you're suffering with chest pains, they'll do an examination and an ECG, and if everything looks normal, they'll send you home. But they'll also send you for further tests. When you get to the angioplasty test, that's when things are starting to get more serious because they're expecting some blockages or some narrowings. The patient's medical history is looked at, medications, allergies, all reviewed, risks and benefits are explained, and consent is obtained for the next stage. So you go into sedation or a local anaesthetic. The patient is given a mild sedation to relax. Local anaesthetic is applied to the wrist, radial artery or groin, femoral artery. Then artery access is required. A small puncture is made in the chosen artery and a sheath, thin tube, is inserted to provide access for guide wires and catheters. A catheter is advanced through the artery to the coronary artery under X-ray guidance. A contrast dye is injected into the coronary arteries. X-ray imaging identifies the location and severity of any blockage.
I often think back to who was the first person to have this done.
Yeah.
And I suppose it's by doing it on medical research, on bodies and things like that.
It's a bit like your drug you're on, somebody's got to be the guinea pig for the first time.
But who thought of pushing this thing up the vein?
I know.
Like that,
I know. It's incredible, really. It's now considered quite a common operation.
You hear loads of people who've got stents nowadays.
Yeah. Anyway, the guide wire navigation is tricky. A thin guide wire is carefully threaded through the blockage into the artery to act as a track for the balloon and the stent equipment. A balloon catheter is advanced over the guide wire to the blockage site. The balloon is inflated to open the artery and prepare for the stent. It's a little bit different to how I explained it because that's how I understood it.
Yeah.
But this is the procedure. Then you've got the stent deployment. The stent is mounted on the balloon catheter, is positioned at the blockage. The balloon is inflated, expanding the stent and pressing it against the artery walls to restore blood flow.
So when you just before you mention that, when you have the stent, do you instantly feel better?
No, not really, because you're not putting your heart under any stress, so you're just laying there. Well, some people probably do if they've come in with a heart attack and they're feeling pain.
Yeah.
But I didn't. I didn't notice any difference laying on the operating table. Additional dye and imaging confirm the stent is fully expanded and that blood flow is restored. If needed, further adjustment or additional stents are placed. Now, the recovery process, the sheath is removed and the puncture site is closed and monitored. Patients are typically observed for a few hours to a day. Medications such as anti-platelet therapy, aspirin, are prescribed to prevent clotting around the stent.
Are you on aspirins and all stuff like
I'm
that?
on an aspirin a day for the rest of my life.
Yeah.
To prevent clotting.
And other tablets or?
Loads of other tablets. Statins and you name it. So, yes. So that's the procedure. So not really anything to be afraid of. If you're a bit squeamish when it comes to blood or operations, you can just lay there and close your eyes and let them get on with it. Now, I didn't feel the cut on the wrist or in the groin because that was
numbed. Yeah.
I did feel funny little sensations in my chest when they were doing it, but no pain or anything, just a funny little sensation, a bit like a sort of I don't know how to describe it really, just a little prick or a... I was trying to avoid that word, but I knew what would happen if I did. So, no...
Viewers, this is a clean show, so I won't even reply to that.
No.
Or listeners, I should say, not viewers.
This was a successful stent operation, so I don't know what happens if something goes wrong, but as far as successful stent operations go, there was no real pain or anything to be afraid of.
Yeah.
And the recovery, they put you on an ECG and keep monitoring your heart, keep monitoring the wound.
How long was you in recovery for?
Well, I went back on the ward for a day, and then they put me on a normal ward for another day, and then I left the following day. So I was in hospital for a total of 3 days. And that was following a heart attack, not just a routine stent procedure.
Yeah.
Now, there are a few side effects, not many to worry about. Bruising or soreness around the insertion area, swelling or minor bleeding on the puncture site, a little bit of mild fatigue, mild chest discomfort, and a low-grade fever sometimes, so not a lot.
A fever?
Yeah, some people come out with a fever. I don't know whether it's a reaction to the anaesthetic more than the operation itself. I didn't, but some people sometimes occurs due to the body's response to the procedure. You also go onto a drug for a year so that the body doesn't reject the stent.
Yeah.
Because there's a foreign body in your body now.
Yeah, because a lot of people don't know about how these stents work, so it's quite informative how you're telling and the experience that you've had of having them yourself.
Yeah.
We do anything for this podcast, don't we?
We do, yeah. I mean, there are more side effects related to the medication, believe it or not, and probably you can believe that with your medication.
Yeah.
Nausea or stomach upset can be one of the biggest things, because obviously your stomach has taken these new drugs for the first time. You do bruise really easily for the first time. I mean, I bruised my arm, and that come up. I clonked it on a chair, and it wasn't a painful clonk.
Right.
But then I had this huge bruise on my arm.
Yeah.
And that's due to the drugs. So easy bruising can be caused by blood thinning medications, which are required to stop blood clots. You can have allergic reactions, of course. We can have that with any drug, can't you?
Yeah.
You might have an irregular heartbeat. Usually resolved quickly, but sometimes requires monitoring.
Loss of memory?
Pardon?
Loss of memory?
Loss of hearing.
Yeah.
These guys have carried these stents out for years now.
Yeah.
And they're improving all the time. It's really quite a simple operation. And it's easy for me to say, it's not something you should worry about if that's something you're facing. Ask as many questions as you can, really, and take it from there.
So how often do you go in for a checkup?
Well, they check me up now. I have a yearly checkup.
Is that because you've got on well with it?
Yes.
Because once a year doesn't... I would have thought you'd have at least every 6 months.
Yeah, I have. It's once a year, but I can go in for checkups any time I like.
Right.
A bit like you. If you get an issue, you can ring up and say, and they'll see you straight away, more or less.
Yeah.
If it's heart related. I mean, if I rang up the doctors today and said, I'm having chest pains, they'd say, get up here now. Or call an ambulance.
Go to A&E.
or call an ambulance.
Yeah.
Wendy took me into hospital both times when I had a heart attack. Both times the ambulance driver said you should have called an ambulance.
Yeah.
Because it's terrible waiting for an ambulance to arrive, and 9 times out of 10, they're there in 20 minutes, 30 minutes.
But they've got the stuff on board.
But they've got the stuff on board to start treating you straight away.
Yeah.
The other thing is, the trip to the hospital is the same time.
Yeah.
But, you still got to be seen and be dealt with.
Although they do have the blue lights and can get through a little bit quicker, but I don't think they get done for speed.
Well, their advice was call the ambulance if that happens again.
Yeah.
So, and I just felt that was wasting their time. I shouldn't feel like that, I suppose.
No. I think I'd probably feel the same way, but then I think.
One thing that often occurs on a regular basis when you're normally fit and healthy, you shake off aches and pains, don't you? You'll get a pain in your arm, you'll shake it off. You'll get a pain in your chest, you won't think nothing about it. You think you've pulled a muscle.
Yeah.
Well, you get heightened awareness after you've had heart surgery or stent implants. Your brain just heightens its awareness to anything that revolves around your shoulder, your chest, your arm, your left arm in particular. And you think every little twinge is related to your heart.
Yeah.
And that's where a positive mental attitude comes in. Again, because you've got to try and distinguish the serious twinges from the everyday twinges. And some people can't do that. They worry, they're anxious, they suffer from anxiety. So any little twinge they get in their body, bang, that's got to be related to the heart.
Yeah.
Maybe I'm a little bit too blasé about it, I don't know.
Well, I think I am, because like you mentioned, I didn't even think of the cancer in my brain. I just thought, I can't drive my car.
Yeah.
So we're thinking beyond.
We've got a positive outlook, haven't we, all the time, And I don't want to waste people's time. That's my biggest fear. I don't want to go in there and say, I've got a pain in my chest, and they say, I've got indigestion. Burp a couple of times.
Yeah.
But I do try and burp if I get a pain there to see if that relieves anything. And 9 times out of 10 it does. So that's really the stent process.
Yeah.
There's not really a lot to worry about.
Well, I've learned something from this, where they go in. As I said, I've always thought that because it's heart related, they go in near your heart.
Yeah.
So, but thinking about it, I can see the route round of all the, the veins that pump to your heart.
That's an incredible operation, incredibly skilled. As I say, it's quite common now.
Yeah.
It's surprising how many people you talk to and say, oh, I've had stents, and I'm on statins.
Mm-hmm. That's what I said about how did they learn this skill. It must be on people who give their bodies to medical science, I suppose.
I guess so.
And they push this thing up the vein and all that, because you wouldn't say to Joe Bloggs on the street, can you come in here? I just want to try this out on you, would you? So,
no. Of course, you have to sign all the papers and saying that you won't hold the hospital responsible if anything goes wrong, because sometimes things do go wrong. You know?
On the side effects, going back to them, is the last one death? No, mine on my tablets.
Yeah,
it says you can get this, vomiting, blah blah blah, diarrhea, and then you go down the last one always says death.
I think most pharmaceutical companies now are putting death on the side effects, which is a little bit worrying.
Yeah,
but they're covering themselves. But yeah, obviously, everybody reacts differently.
Yeah,
I have to carry, and I have been carrying for the last 15 years or so, a GTN spray, which I'm showing Martin now.
Yes, and I know about these, but you explain to the listeners all about it.
Well, this GTN spray is to help open your arteries. Mm-hmm. So if you do, the biggest problem with a narrowing of the arteries is if you get a blood clot. And your blood can clot if it's thick blood, and depending on what your diet is, if you're eating a lot of dairy, you can thicken your blood up and have high cholesterol. And the biggest risk with a heart patient, and you never know when this might come, is a blood clot. And basically there's a bit of dry blood, like when you cut yourself and your blood clots and stops bleeding, you get dry blood on your skin, don't you? Well, that can happen in your arteries. And if you get a piece of dry blood or a blood clot floating around your arteries, coming up to your narrow spot and then blocking it, that's when the problems begin, because that blocks the blood flow to your heart, creating either a heart attack or a cardiac arrest. And then the risks from that go on, it can cut the blood supply to your brain or the oxygen supply to your brain, and you can become brain damaged if you're not treated fairly quickly. So the GTN spray is if I suddenly find I've got very, very severe chest pains, pointing to a blockage.
Is that glycerine?
Yes.
Yeah.
Pointing to a blockage or a narrowing or something going on in my heart, I can spray this under my tongue. And what that does is that thins the blood out and hopefully helps unblock the heart blockage.
Oh, that's what it does, yeah.
Or the blockage in the artery, and relieves the pain.
Do you get a pain here on your head, right in the middle of your forehead, when you have that spray?
I haven't. I've only used it once.
All right.
And that was when I was having my second heart attack. But I was so out of it, I didn't really know what pain I was getting.
So you should tell me that you've got that in your pocket.
Yeah.
Because if anything ever happened to you, sitting in our he shed, then I could administer it to you.
Yeah, you could, yeah.
Because I don't want to give you the kiss of life.
No, I don't want you to give me the kiss of life. Especially with the stubble you're fashioning at the moment. But no, you spray this under the tongue twice and leave it for a while. And if the pain goes away, great. If it doesn't, you do another spray twice. And if the pain still remains, then you call 999.
Yeah.
If you have a cardiac arrest, then you need immediate medical care. And that normally involves a defibrillator to restart your heart, because the difference between a heart attack and a cardiac arrest is that a heart attack is when blood flow is restricted to your heart. A cardiac arrest is when your heart electrics break down. Someone unplugs you and there's no electrics in your heart to pump the blood around your body.
Yeah.
And that's where you need to restart the heart. But at the same time, chest compressions must be administered, because you cannot afford for the oxygen flow to your brain to be diminished, because that's when you can suffer from brain damage as well.
Yeah, the lack of oxygen to your brain, isn't it?
Lack of oxygen.
That's what happened to my poor mum.
Yeah.
When the air ambulance was called, they said that she'd been starved of oxygen to the brain, and that she would be, brain damage or whatever.
Yeah.
And never live a normal life.
No.
Which that's what made us had to say to turn the machine off.
In those instances, what's normally happens is because you've got electrical activity in your heart at that stage, you're taken on to hospital and you're put on a life support machine because your brain can't control all the organs in your body to run your body successfully.
Yeah.
And unfortunately, you have to make the decision, as you did, to turn it off because the brain was so badly damaged.
Well,
So,
Patrick, you said you're not a doctor, but you've given us lots of medical facts today.
I didn't say I wasn't a cardiologist, though, did I?
True.
That's just a basic patient understanding of the whole procedure.
Yeah.
I've got things wrong a little bit there. I don't know, but generally that's what happens.
But all the comments are your feelings and how
My experiences.
Yeah, that's right.
Yeah.
And not necessarily that happens to everybody, but you must always fear any twinges, though, don't you? And
I think Wendy lives with the constant fear of another heart attack. And I don't help myself sometimes with the food that I eat because I do like my food. I don't smoke. I don't drink. Smoking is a real no-no when heart disease is discussed. Alcohol, not so, but in moderation.
yeah.
And diet is another thing. So I get 2 out of 3 right. Mm-hmm. So I do try.
What's your name, Meatloaf?
Yeah, I can't pass a donut stand without having a donut. I'm afraid we've both got that.
Yeah, we have.
Is that an allergy or is that
I think that's
an addiction or
a mate thing.
Yeah, it could be called an addiction, I suppose.
Yeah.
But I do love the donut. So
Me too. And the burgers that are fatal. So I'm like, oh, I can't resist having a burger. But no, that's given us a fantastic insight. And as I say, I've learnt something. So hopefully our listeners have learnt something as well.
and if you've got any questions, don't be afraid to fire them to us. We'll do our best to answer them.
Yeah, we will.
Well, that brings us to the end of another podcast, mate.
I haven't done my joke of the week.
Do you want to do one?
Yeah.
Okay. Well, let's end on a sad note. Martin's joke of the week. Okay, well, we have got the benefit of a joke book that's been supplied by one of our listeners, Richard Martin. And I know he likes getting a mention, so I'll mention him.
I wouldn't name him after this joke book.
Well, he's always telling us how jokes need to get better, so this one's down to him.
Yes.
So here we go. Martin's joke of the week.
So a man phoned the hospital in a state of excitement. My wife's pregnant. Her contractions are only 2 minutes apart. The doctor said, "Is this her first child?" He said, "No, you idiot, it's her husband."
Oh, it wasn't too bad, was it?
Is that better than my ones?
Oh, I think that was probably. Sorry. Thanks, Richard, for sending that book in
Thank
to
you.
us.
Yeah.
And uplifting our...
Others may
joke.
be used in the future.
There's only a few thousand to choose from there.
Yeah. Yeah, but I can't use all these. Some are rude.
Anyway, guys, thanks very much for listening, as always. And we'll be back next Friday, same place, same
time.
Take care.
Thanks very much, everyone. Bye.
Have a good one. Bye.
Bye.
You've been listening to the Who's Tom and Dick podcast with your hosts, Martin Weavers and Patrick Mortimer. If you enjoyed this episode, please subscribe to the show on Apple, Spotify, or your favorite streaming platform. New episodes are available every Friday. Thanks for tuning in.
Away the gloom. Years go by, but their bond stays true. Through thick and thin, always breaking through. They'd reminisce under the old oak tree, sharing secret dreams. Just Tom and Dick, you see. Old mates, forever in sync. With stories to tell and a drink to link. Through laughter and tears, we rise and we fall. Every moment together, they cherish it all.